Welcome in, everybody, to another deep dive. Um, Today, we're going to be looking at measles, something that a lot of people thought was a thing of the past, but it's popping up in the headlines again. And the situation in Texas is really concerning and kind of forcing us to take a look at it.
It really is, and we've gotten news releases and health department data, and we even talked to a doctor here in Georgia who's seeing some things that are pretty similar to what's happening in Texas, and it's a little concerning.
Yeah, and we should say right off the bat that this isn't just a Texas problem. So we want to look into this and see what it means for everyone, especially those of us here in Georgia. But let's start with that headline that really got everyone's attention. Texas reported its first measles death in this current outbreak.
Yeah.
It was a school-age child.
Yeah, and that really highlights the fact that measles can be fatal, especially for unvaccinated children. And so this case in Texas has really kind of brought the issue of vaccine hesitancy to the forefront.
And that's something that we definitely want to talk about in detail in a little bit. But first, can you give us an idea of the scope of this outbreak in Texas? What are the numbers looking like?
Yeah, so since late January of this year, Texas has had 124 confirmed measles cases,
Wow.
and most of these cases are in children, and 18 of them have been hospitalized on top of the death that we already talked about.
124 cases. That's a big number. And it's a huge difference from where we were just a few years ago.
Hmm.
Measles was declared eliminated in the U.S. back in 2000. And this is a reminder that even though it was eliminated, it can come back if vaccination rates drop.
Absolutely. Measles is super contagious, and it only takes a small drop in vaccination rates to create an opportunity for it to spread.
So for those of us who maybe don't remember, or for the younger generation who have never seen measles, what does this even look like? What are the symptoms?
Well, measles starts with things that seem like just a normal cold, high fever, cough, runny nose, that sort of thing. But then you start to see the classic measles rash, which is like flat red spots that start on your face and then spread down the body.
And it's not just a rash, right? There can be some serious complications from measles.
Oh, absolutely. Measles can lead to things like pneumonia, swelling of the brain, which is called encephalitis. And as we've seen in Texas, it can even be fatal.
And it seems like unvaccinated children are the ones who are getting hit the hardest.
Yeah.
The CDC says that 95% of the people who were infected with measles in the U.S. were either unvaccinated or their vaccination status was unknown. And the child who died in Texas was not vaccinated.
Yeah, and that just really shows how important vaccination is to protect ourselves and our communities from measles.
It makes you wonder, why are we seeing these outbreaks in the first place if the vaccine is so effective? We celebrated eliminating measles in the U.S. not too long ago. How do we end up back here?
Well, the elimination of measles was a huge win for public health, but it depended on keeping vaccination rates high. When vaccination rates drop even just a little bit, it creates these pockets of vulnerability where the virus can start to spread.
So it's almost like a safety net that's starting to have holes in it. We're seeing those gaps in protection, and that's where the virus is spreading. We talked to a doctor here in Georgia, Dr. Timothy Connolly, and he said that more than 90% of people who are exposed to measles and aren't vaccinated will get the disease.
Wow, that's a big number.
Yeah, that's a staggering statistic.
It is. It really shows how important it is to understand how vaccines work and how they protect us and our communities.
So let's talk about Georgia for a minute. We've been talking about Texas, but is there any concern that this could spread to Georgia? Are we at risk here?
Yeah, that's what a lot of people are wondering about, and it makes sense. Texas isn't that far away, and we know that viruses don't care about state borders. People travel, and that means diseases can travel too. Dr. Connolly, the doctor we mentioned earlier, has said that he's worried about the possibility of measles coming back here in Georgia.
Oh, wow. So he's seeing some similarities between Texas and Georgia.
He is. You see, the vaccination rate for kindergartners in Georgia during the 2023-2024 school year was only 88.4%. And the CDC says we need at least a 95% vaccination rate for herd immunity.
In herd immunity, that's when enough people are vaccinated
Yeah.
that it helps protect the people who can't be vaccinated for medical reasons, right?
Exactly. It's like a shield that protects the most vulnerable people in our community. But when vaccination rates drop below 95%, the shield starts to weaken and it's easier for the virus to spread.
So even though we haven't seen an outbreak as big as the one in Texas, we're not out of the woods yet. We had 6 cases of measles in Georgia just last year in 2024.
Right, and that might not seem like a lot compared to Texas, but it does mean that the virus is here and it could spread quickly if more people don't get vaccinated. Dr. Connolly's concerns are valid.
Okay, so we have this outbreak happening in Texas, and Georgia's on high alert. But the big question is, why are vaccination rates going down in the first place? This felt like a problem we had already solved.
Yeah, that's the million-dollar question, and it's complicated. There's not one easy answer. Dr. Connolly thinks that some of this hesitancy around vaccines might be because of concerns that started during the COVID-19 pandemic, specifically concerns about the mRNA vaccines.
And we should say here that we're not trying to take sides in the debate about vaccines. We just want to understand the situation, and we recognize that vaccine hesitancy is complicated. There are a lot of different reasons why people might be hesitant to get vaccinated, and it's important to be understanding and listen to people's concerns.
I agree. It's important for people to make decisions about their health and their children's health based on accurate information and to talk to their doctors.
For sure. But let's talk a little bit more about the potential consequences of measles, because it's not just about getting sick, right? There can be long-term problems that last for years.
That's a really important point. Measles can have what we call hidden dangers. One of the things that can happen is a rare but very serious type of dementia that can develop years after someone has had measles.
Dementia. That's a serious long-term risk, and a lot of people probably don't even know about it.
Yeah, it is. It's definitely something to be concerned about, and it makes this whole conversation about measles and vaccination even more complicated.
So we've covered a lot in this first part of our deep dive. We've seen how this measles outbreak in Texas is a serious reminder of how dangerous this disease can be and what happens when vaccination rates drop. And we talked to a doctor here in Georgia who's concerned that the same thing could happen here.
Yeah, we've only just scratched the surface of this whole issue of vaccine hesitancy. There's a lot more to talk about.
For sure. So stay tuned for part 2 of our deep dive. We're going to talk more about the reasons behind vaccine hesitancy, and we'll dig into the history of measles and look at what the long-term effects of this disease can be.
Yeah, and we'll talk about what we can do as individuals and then as a society to stop measles from coming back again. This is something that affects all of us.
So we've been talking about this measles outbreak in Texas, and the possibility of it spreading to Georgia. But I really want to take some time to dig into this whole vaccine hesitancy thing. It's obviously a big reason why this is happening, but it's also a really complicated issue with a lot of different factors.
You're right. It's not just a simple yes or no kind of thing. Vaccine hesitancy is a mix of so many things, like misinformation, distrust people's personal beliefs, and even just access to healthcare.
Yeah, it's fascinating and kind of scary that even though there's so much scientific evidence that shows that vaccines are safe and they work, we're still seeing so much hesitancy about them. It's almost like we're living in two completely different worlds. One world where scientists agree that vaccines are good, and another world online where people are spreading false information about vaccines.
That's a good way to put it. The internet can be great for sharing information, but it can also be a place where false claims and conspiracy theories about vaccines can spread easily, and those things can be really convincing, especially when they play on people's fears.
I feel like people are just overloaded with information, and it's hard to know what's true and what's not.
Right, and it's human nature to want to believe things that fit with what we already think, even if those beliefs aren't based on science.
So how do we fix this? How do we talk to people who are hesitant about vaccines without making them feel judged or dismissed? Because I think part of the problem is that people have become so divided on this issue.
I think the first step is to just listen. Really listen to what people are concerned about and try to understand their fears and let them know that it's okay to feel that way. It's about creating a safe space for people to talk about their doubts and ask questions without feeling like they're being attacked.
That makes sense. It's about building trust, right?
Yeah.
Trust in the healthcare system, trust in scientists, and trust in the information that we're getting. And the trust doesn't happen overnight. It takes time, patience, and communication that's clear and honest.
Exactly. And we have to remember that everyone has different reasons for being hesitant about vaccines. Some people believe misinformation. Some people have religious or philosophical reasons for not wanting vaccines. Some people are worried about side effects. And some people just don't have access to good health care.
You know, during the COVID-19 pandemic, there was a lot of talk about how some people didn't trust the government or medical professionals, and that made them hesitant to get vaccinated. Do you think that's still an issue?
I think it's definitely still part of the problem. In the past, there have been times when certain groups of people, especially marginalized communities, were treated unfairly by the healthcare system. And those experiences have led to a lack of trust. And we saw that distrust come up again during the pandemic.
So it's not just about proving that the myths about vaccines are wrong and giving people the facts. We also have to address those bigger systemic problems and rebuild trust.
Absolutely. And that requires a multifaceted approach. We need to make sure everyone has equal access to healthcare, help people understand health information better, and communicate with people in a way that's sensitive to their culture and beliefs.
It's about meeting people where they are and understanding that there isn't one right way to talk to everyone about vaccines.
Yeah, and it's about understanding that people's opinions about vaccines can change over time. Someone who is completely against vaccines today might be more open to them in the future if they get the right information at the right time and in the right way.
Okay, so we've talked about how complicated vaccine hesitancy is and how important it is to be empathetic and understanding. But let's get back to measles. We've talked about the outbreak in Texas, the dangers of measles, and the possibility of it spreading to Georgia. So what's next? Is this something we're going to have to deal with forever? Or is there a way to get rid of measles for good?
That's the question everyone wants to know the answer to, but unfortunately, there isn't a simple answer. Measles is tough. It's really contagious, and as we've seen, it can take advantage of any weaknesses in vaccination coverage.
So even if we fix things in one place, it can just pop up somewhere else, like a game of whack-a-mole?
Yeah, kind of. It's a global issue. As long as there are places in the world where people aren't protected from measles, it can come back and spread.
Okay, so what can we do then? What are the big takeaways for our listeners? What can we do as individuals and as a community to prevent measles from becoming a problem again?
Well, the most important thing is if you haven't been vaccinated against measles or if you're not sure, talk to your doctor. Getting vaccinated is the best way to protect yourself and the people you care about from this serious illness.
So it's about taking responsibility for your own health, but also realizing that your decisions affect the health of everyone around you.
Exactly. It's about community health. When more people are vaccinated, it's harder for an outbreak to happen, and that protects everyone, especially the people who are most vulnerable, like little kids who are too young to be vaccinated, or people with weak immune systems who can't get vaccinated for medical reasons.
It's like that saying, it takes a village, right? We all have to work together to protect our community from diseases that we can prevent.
I like that analogy. It really does take a village. We need to support policies that encourage vaccination, teach each other about why vaccines are important, and speak up when we see misinformation.
And we need to do all of this with kindness and understanding, remembering that people have different reasons for being hesitant about vaccines.
You know, something I found really interesting while we were researching this is that some people are hesitant about vaccines because they haven't seen firsthand how bad these diseases can be. For a lot of younger people, measles, mumps, rubella, they're just names in a book. They've never actually seen anyone suffer from these diseases.
If you've never seen something, it's easy to think it's not a big deal, right? But those of us who remember what it was like before we had vaccines, we know how serious these diseases are.
Exactly. And maybe sharing those stories, those personal experiences, could help people understand why these vaccines are so important.
So it's about making this issue more real, more human.
Exactly. And it's about remembering that this isn't just about science, it's about protecting the health of our families, our communities, and the people who will come after us. But we've been talking about the US, and this is a global issue. Measles doesn't stop at borders. So what can we do about this problem on a bigger scale?
Yeah. That's a great point. It's easy to focus on what's happening close to home, but this is a fight that the whole world needs to be involved in.
Exactly. We need to work together as a global community. We need to help countries where measles is still a big problem increase their vaccination rates.
So we need to share our resources, our knowledge, and our expertise to make sure that everyone everywhere has access to the protection they need.
Exactly. And we need to understand that everyone's health is connected. What happens in one part of the world can affect everyone.
So to really beat measles, we need everyone in the world working together.
Yes, and that means that governments, public health organizations, doctors, and everyday people all over the world need to be committed to this.
That's a big challenge, but the stakes are high. Measles is a serious disease, and we've seen how bad things can get when it comes back.
The fact that measles is making a comeback shows us that we can't just assume that diseases that we can prevent with vaccines are gone for good. We have the tools to get rid of measles, but we have to keep working at it.
So what's next? What's the next step in our deep dive into the world of measles?
We've done a lot so far. We've talked about how complicated vaccine hesitancy is, and we've talked about the challenges we face both in the US and around the world. Now I think it's time to go back in time and look at the history of measles to understand how we got to where we are today and what we can learn from the past.
I like it. A trip through time to understand the present.
Yeah.
So stay tuned, everyone. We're just getting started. We've talked a lot about the measles outbreak that's happening right now and about why some people are hesitant to get vaccinated. But now I want to go back in time and talk about the history of measles.
Yeah.
You know, it's easy to forget that this disease has been around for a really long time, way before we had vaccines.
It's crazy to think about, isn't it? Measles has been affecting people for thousands of years all over the world.
It really makes you think. So how did we go from those times when measles was so common to actually eliminating it in the U.S. back in 2000? What happened?
The big change was the measles vaccine. That was a huge moment in science, and it completely changed how we deal with this disease.
Vaccines, they're often called one of the most important things we've ever done for public health, and they deserve that title.
I agree. The first measles vaccine was approved in the U.S. in 1963, and it's not a coincidence that after that we saw way fewer cases of measles. We're talking about a 99% drop in cases. It was a really big improvement.
Well, it's hard to imagine how big of a difference that made,
Yeah.
especially now that we're seeing these outbreaks again. I think it's easy to forget how well these vaccines have worked to protect us.
It shows just how powerful science can be and how dedicated all those researchers and doctors were to developing and giving people this vaccine that saves lives. But it also reminds us that we can't just assume everything's fine now.
Right. We declared victory over measles in the U.S. in 2000 when it was eliminated. But as we've seen, it can come back. It all depends on keeping vaccination rates high and having a strong public health system.
And it's important to understand that eliminated doesn't mean gone forever. Measles is still out there in other parts of the world, and it can come back to the U.S. if we're not careful.
So even though we were able to eliminate it, the threat was never really gone. We're seeing that now with these outbreaks in Texas and those cases in Georgia. What I find interesting is that some of the problems we're facing now, like people not wanting to get vaccinated, aren't new. They've been around as long as we've had vaccines.
Oh, absolutely. There were people against vaccines even back in the 1800s. They were spreading misinformation and didn't trust doctors. It seems like there's always been some pushback against vaccines.
So this skepticism and resistance that we're seeing now has been around for a long time. It's not just because of the internet, even though social media has made it easier for these voices to spread.
Right. The way people are talking about it might be different now, but the basic ideas have been around for centuries. It's important to understand the history and the social context of vaccination.
It makes you think, is there anything we can learn from what happened in the past? Is there anything that can help us deal with these problems today?
One thing we can learn is that it's really important to be clear and honest when we communicate with people. When people understand how vaccines work and they trust the people who are giving them information, they're more likely to get vaccinated. But when that trust is broken, people start to hesitate.
So it's about working together, not fighting. Talking to each other respectfully, addressing people's concerns, and understanding that people have different and complicated reasons for their opinions about vaccines.
Exactly. And another thing we can learn from the past is that we have to stay vigilant. We can't just relax and think that measles or any other disease that we can prevent with a vaccine is gone for good. The second we start paying attention, these diseases can come back.
So it's a constant effort, not a one-time win. We have to keep vaccination rates high, support our public health systems, and be ready to deal with outbreaks quickly. We have to be proactive, not reactive.
I agree. And we have to remember that this is everyone's responsibility. It's not just up to doctors and public health officials. It's up to all of us to do our part to protect ourselves, our communities, and the people who will come after us.
Well said. As we wrap up our deep dive into measles, what's the most important thing you want our listeners to remember?
The most important thing is that knowledge is power. The more we know about measles, about vaccines, about the history and the science, the better decisions we can make for ourselves and our families.
And those decisions can make a real difference in stopping measles from coming back.
They can. It's about taking charge of our health, supporting good public health policies, and talking to each other about vaccines in a thoughtful way. We have the tools to stop measles from becoming a problem again. We just have to use them the right way.
Thank you for joining us for this deep dive into the world of measles. It's been really interesting and sometimes a little bit scary. We've learned about the history, the science, the challenges, and the hope that comes from working together.
And remember, this isn't the end of the conversation. Keep learning, keep asking questions, and keep talking about how to protect our health and the health of our communities.
That's right. Stay healthy, everyone.